I assumed it was abnormal because it was over 140. You sometimes get a C rating or something like that in a health checkup, right? Sometimes cholesterol medication is prescribed, but that's not really common, so I think it's important to stay calm for now. Now, I want to share a shocking fact, but first, thanks for watching. This is YouTube Medical University. Today, I'll be talking about the truth behind health checkups, focusing on health screenings and cancer screenings. Let me get right to it. Have you ever had a health checkup or a cancer screening? Most of these tests are extremely important. However, there are some people who undergo tests that are not generally recommended. Feeling satisfied after the test isn't enough. If you can't interpret the results, you might still hear C rating, follow-up observation needed. You end up feeling anxious, wondering what you should do, and as a result, it often doesn't actually lead to better health. Patients often visit the outpatient clinic saying, "I was told I got a C rating and need follow-up observation, but what should I do?" They arrive feeling very anxious. Many of those people, once they get the right information, are able to understand and say, "I see, so I don't need to worry that much." Knowledge can be a weapon, so when it comes to health checkups and cancer screenings, don't just be satisfied with having taken them. Instead, think about what kind of tests you actually need and how you should interpret the results. I'll explain things clearly from a doctor's perspective. At YouTube Medical University, we deliver easy to understand, responsible videos to help you get healthier starting tomorrow. I'd be really happy if you could subscribe to the channel so you don't miss any new videos. Now let me explain the 6 important truths about health checkups that you should be aware of. 6 important truths about health checkups you should be aware of. The first one is cholesterol levels. I'm sure many of you have had your cholesterol flagged during a health checkup. In fact, at YouTube Medical University, we've talked about this many times. We've explained that cholesterol can cause arteriosclerosis, and that arteriosclerosis can lead to blockages in the blood vessels of the heart and brain. It's true that having high cholesterol can cause arteriosclerosis. This is a clear risk. However, if you ask whether everyone with high cholesterol should start taking medication right away, the answer is actually no. First of all, the reference values used in health checkups are not actually normal values. Reference values are just that, reference. When ordinary people get tested, 95% of them will fall within this range. These are the reference values. Just because your results fall outside of this range doesn't necessarily mean there's something wrong. For example, let's say in a 50-meter dash, it's said that about 95% of people finish between 12 and 20 seconds. So, does that mean someone who can run it in 10 seconds is abnormal? That's not the case, and even if someone takes 22 seconds, that doesn't necessarily mean there's anything abnormal. So it's important to be careful about how we interpret these reference values. In reality, the reference value for low-density lipoprotein cholesterol, bad cholesterol, is set at 140 or below. Just because this value is exceeded doesn't mean you immediately need medication. Whether or not to actually use medication is determined by considering each person's risk of arteriosclerosis. Do you have diabetes? Do you have any kidney disorders? Have you ever had a disease where your blood vessels became blocked? Do you smoke? Gender? Various factors are taken into account to determine your future risk. We predict whether your risk of blood vessel blockage will increase, and after discussing it with you, we decide whether or not to use medication. So, just because your number is over 140, you might automatically get a C rating or be told it's abnormal in a health checkup. Some people feel discouraged as if their lifestyle has been rejected, but please don't take it too hard. Generally, if your cholesterol is high, we don't immediately start talking about medication. What's important is your lifestyle habits. First, review your diet and exercise for a month. If your cholesterol drops, we might say, let's skip medication this time. At some hospitals, cholesterol medication may be prescribed right away. However, that's not very common, so I think it's important to stay calm and not rush into things. And now, I'd like to share a shocking fact with you. First of all, should we even be testing cholesterol in people who have no symptoms or risk factors? Actually, that's not the case. In fact, there is no data showing that general health checkups lower the mortality rate compared to those who don't get them. There have been various studies on this. The reality is that there is no solid data. So, to put it bluntly, when it comes to whether or not it reduces mortality rates, it's not necessarily true that you should actively undergo health checkups. And when it comes to this bad cholesterol as well, it's actually not the case that everyone should be tested for it. Each country has its own guidelines, and there are general recommendations like, these people should get their cholesterol checked, and these people don't need to. For example, as a guideline, it's decided that men over 40 and women over 50 who have reached menopause should have their cholesterol checked at least once. Despite that, in Japan, workers are required by the Industrial Safety and Health Act to undergo health checkups. People are being tested when they shouldn't be. They're told to go to the hospital due to abnormal results, which depresses or discourages them, making them blame their habits. In Japan, health checkups typically include interviews, blood pressure measurement, blood and urine tests, and these are done uniformly for all. For example, the United States doesn't do that. Since healthcare systems differ, it's hard to compare, but in the United States, insurance companies provide these services. They recommend vaccinations or conduct tests for sexually transmitted infections based on the person's age, gender, and risk factors. They also offer very personalized lifestyle counseling. That's quite different from Japan, isn't it? And in the United States, screenings for diabetes, cholesterol checks, and cancer screenings are only conducted for people at higher risk, such as the elderly. They conduct tests according to age and gender. This way of thinking is very important, and I think it will be reconsidered in Japan in the future. If you'd like, you can also learn from the videos on YouTube Medical University and think about what kind of disease risks you might have. So I hope you can understand those things and wisely choose which tests to take. Is it possible to lower cholesterol through diet without relying on medication? If you've ever wondered that, I've posted videos about it in the past, so please check them out from the description below after this. The second of the 6 important truths about health checkups you should be aware of is this. It's triglycerides. After cholesterol, understanding triglycerides is also important. You need to understand them. I often say that there's no need to be overly concerned about them. The reason is, triglycerides are influenced by diet. For instance, if asked, "Did you eat before coming here today?" and you reply, "Yes, I did." Sometimes when we look at your triglyceride levels while fasting when you haven't eaten, we might say, "With these numbers, I don't think there's any problem." Sometimes we may do another test. And when it comes to triglycerides, even if the levels are high, it doesn't necessarily mean you need to take medication. There is no data, so taking medication solely for high triglycerides isn't recommended by current evidence. According to a highly reliable paper, a meta-analysis published in Journal of the American Medical Association in 2009, the results showed that having high triglyceride levels did not actually increase the risk of developing diseases where the blood vessels in the heart become clogged. Opinions differ on whether triglycerides speed up arteriosclerosis and affect future disease risk. Data is available, but no clear conclusion has been reached. I want everyone to remember one thing. This may be a difficult topic. Just because your triglyceride levels are high and your vascular risk increases, it doesn't necessarily mean you should take medication. To decide whether you should take medication, we need to see if people who took the medication actually ended up having a lower risk of getting sick compared to those who didn't take it. Without solid data, we can't say that you should take the medication. That's why various clinical trials are being conducted on medications that lower triglycerides. However, there is currently no solid data showing that taking the medication actually lowers the risk of disease. In other words, there is no definitive data that prescribing it reduces the risk of death. That's what it means. Isn't this surprising? High triglycerides alone don't always need treatment. It depends on the individual, family history, and other factors. Depending on other risk factors for arteriosclerosis, there are cases where the treatment plan involves lowering triglycerides along with cholesterol, but that's not very common. However, one thing to be careful about is when triglycerides are over 1000. When they're that high, it's said that the risk of acute pancreatitis increases. Acute pancreatitis causes intense abdominal and back pain, and it's a serious illness that can be life-threatening. To avoid such a disease, it's recommended to lower your triglycerides with medication if they're over 1000, so please be aware of that. However, in actual medical practice, there are actually very few people whose triglycerides are over 1000, and sometimes a type of medication called statins is prescribed to lower triglycerides and cholesterol. They're commonly prescribed and effective, but can cause a serious side effect called rhabdomyolysis, where muscles break down. This is a barium test. Are you all familiar with the barium test? You drink a contrast agent, which is a liquid that shows up easily on X-rays. By adjusting angles and taking X-rays, they capture your stomach's shape and any bumps on its lining. They check for things like stomach cancer, stomach ulcers, or the presence of H. pylori bacteria. However, my impression is that many healthcare professionals probably don't undergo this test themselves. That's because there's a better test now, the gastroscopy. The reason barium tests are still being done is probably just a remnant of old practices. That's what I think. According to data released in 2022 by the Japan Society of Gastrointestinal Cancer Screening, when comparing people who underwent gastroscopy and those who had a barium test for stomach cancer screening, the number of people in whom stomach cancer was detected was 2.5 times higher among those who underwent gastroscopy. In other words, stomach cancer was 2.5 times more likely to be found with a gastroscopy. And to be blunt, if an abnormality is found with the barium test, in the end, you'll be advised to have a gastroscopy anyway. Is it better to start with a gastroscopy, or only do one if another test finds something abnormal, since stomach cancer can be hard to detect and you might need a gastroscopy anyway? If a gastroscopy is too uncomfortable for you and you never want to repeat it, it's fine to choose the barium test instead. That's right. Some cameras can be inserted through the nose, and gastroscopies often use sedatives, so the procedure happens while you sleep. I hope you'll consider those options as well. And one more important thing. You want to prevent stomach cancer before it develops, right? It's rare for hospitals to talk about this kind of preventive medicine. Actually, this stomach cancer is a cancer preventable 99% of the time. You might wonder if that's really true when you hear it. Actually, it's said that if you can eliminate the Helicobacter pylori bacteria early on, your risk of stomach cancer drops dramatically. And whether or not you have Helicobacter pylori, in order to eliminate it, you ultimately need to get a gastroscopy for a proper diagnosis. Without doing that, you can't proceed with eradicating the bacteria. For those reasons, I think it's very important to have a gastroscopy to check whether you have stomach cancer or are infected with Helicobacter pylori, as this can help reduce the risk of stomach cancer in the future. Methods for testing and treating Helicobacter pylori, as well as important precautions. I've discussed these topics in earlier videos. See the description box for details. The fourth key truth about health checkups is the chest X-ray exam. From here, I'll be talking about cancer screenings. When it comes to chest X-rays, I'm telling you not to get them. It's not that you shouldn't get them at all, but there's one thing you should be careful about, so I want to let you know. The chest X-ray is used to detect lung cancer. Actually, it's not recommended overseas. To talk about this, let me give you a bit of history. In the past, Japan had a much higher rate of tuberculosis infection compared to other countries. Compared to 1972, the number of tuberculosis cases was 10 times higher back then. In fact, even among workers, the rate of tuberculosis infection was high. Since tuberculosis shouldn't be allowed to spread, companies started conducting health checkups for their workers. That's why chest X-rays were introduced. Their original purpose was to detect tuberculosis. Today, however, tuberculosis cases have dropped to just 1/10 of past levels. As a remnant of that, Japan still has a system where chest X-rays are used as a screening method for lung cancer. But for those who think sometimes lung cancer is found through X-rays, that's also true. There are certainly people whose lung cancer was detected and who were saved thanks to X-rays. However, if you ask whether X-rays are an appropriate test for detecting lung cancer, the reality is that early-stage cancer often doesn't show up on X-rays. There are many cases where it is missed, and its usefulness has been denied in 6 past studies. In the United States and other countries in Europe, using X-rays for lung cancer screening is not recommended. So what kind of test is recommended? That would be low-dose computed tomography. Low-dose computed tomography is what we commonly refer to as a computed tomography scan. You lie down, pass through a ring-shaped machine, and your body is scanned. Low dose means that the amount of radiation exposure is low. The radiation level is said to be about the same as that of a barium test, so it's quite low. That's why it's used for lung cancer screening. Currently, X-rays are being used in Japan. However, for people who are actually at high risk or are concerned, I recommend low-dose computed tomography scans. For similar reasons, electrocardiograms are also not recommended for everyone in the general population overseas. Many tests that are routinely performed in Japan actually lack supporting data. In that sense, I think it's very important to have proper knowledge. There is a lot of useful information on the internet. However, there are also some pieces of information that are incorrect. So that you don't end up regretting getting the wrong information, at YouTube Medical University, we present data while explaining things. We share information as clearly as possible from a doctor's perspective. It's very important to have at least one reliable source of information. If you like, please subscribe to the channel so you don't miss any new videos. Here is the fifth of the 6 important truths about health checkups you should be aware of. It's the prostate-specific antigen test. Do you know what the prostate-specific antigen test is? This is a blood test for a tumor marker called prostate-specific antigen used in prostate cancer screening to determine how likely it is that someone has prostate cancer. That's what prostate cancer screening, the prostate-specific antigen test, is. A blood test can reveal if you're at high risk for prostate cancer. It's groundbreaking, and many people want this test. However, you need to be a little careful with the prostate-specific antigen test. Actually, since the prostate-specific antigen tumor marker started being tested, the number of prostate cancer cases has increased. That's right, it's because we're now able to detect it earlier. However, what about the number of deaths from prostate cancer? Actually, it hasn't decreased. So, what does prostate cancer screening mean? Depending on the type of cancer, even if it's found, the prognosis can be good. There are many people who have prostate cancer but pass away from other causes without the cancer causing much harm to their body. In my experience as well, I often see cases like this. So, it's not always best to find everything through screening. The United States Preventive Services Task Force has concluded that the prostate-specific antigen test should not be routinely used for cancer screening in the general population. In Japan, the government doesn't subsidize or organize prostate cancer screening. It's only available as an option. It's set up so that people who want to take it voluntarily can do so. Some may be glad they caught it early, but prostate cancer often causes little trouble. Even after diagnosis, you might just be told to monitor it, which can leave you feeling uneasy and unsure if it's okay to leave it as is. Some people say, the test cost so much it was a big financial burden. On the other hand, there are also people who say, I'm a worrier, so if I can get tested, I want to do it. I don't mind spending some money. If something is found, I can see that as a good thing. People like that might be good candidates for prostate cancer screening. It's important to think about what you would want to do yourself and then choose whether to get tested. That kind of attitude is really important. Please share your thoughts and feelings in the comments section. I think it will be very helpful for other viewers. What other detailed tests are available for prostate cancer? And if it's found, what kind of treatment will be needed if it's discovered? A video explains the psychological anxiety from that time and related topics. For more on the prostate-specific antigen test and to decide for yourself, see the description below. I hope you'll watch the video after this. Here is the 6th important truth about health checkups that you should be aware of. It's the comprehensive medical checkup. I think many people are getting these checkups. However, generally speaking, not everyone needs to get them. To understand comprehensive medical checkups, you should first learn about organized cancer screenings, which are government recommended. There are 5 types of screenings that the general public should undergo: stomach cancer screening, colon cancer screening, and lung cancer screening. The other 2 are cervical and breast cancer screenings, totaling 5 government-endorsed screenings. By undergoing them, these screenings are highly likely to reduce mortality rates. Depending on your city or town, you may receive government subsidies and be able to get these screenings at a relatively low cost. That's the cancer screening we're discussing. Other types are called optional cancer screenings, meaning they're voluntary. These fall under the category of comprehensive medical checkups. So, screenings for things like pancreatic cancer, liver cancer, or prostate cancer. These kinds of screenings are not considered organized cancer screenings. Most screenings are conducted for the general public to detect diseases early and treat them. There is solid data showing that these screenings can reduce mortality rates. On the other hand, that's not the case with comprehensive medical checkups. So, if you ask whether everyone should definitely undergo them, the answer is no. Also, comprehensive medical checkups are not covered by insurance, so you have to pay the full cost yourself. That's why they tend to be quite expensive. Still, some people want health checks, like those worried about cancer after losing a parent, fearing it could happen to them too. It's fine to get a comprehensive medical checkup for reasons like that. However, I want you to understand that it's not necessarily something everyone should do. For example, as I mentioned earlier about prostate cancer, if you have a family history, meaning someone in your family has had prostate cancer, it's recommended to measure a tumor marker called prostate-specific antigen. In this way, it's important to make a smart choice about whether to undergo cancer screening or a medical checkup by considering whether someone in your family has had it and what your own risk is. Getting every medical checkup without considering it can become expensive. They told me, "There's a shadow here, so I went to a major hospital for a thorough checkup. It was just a benign tumor, and they said, you can leave it alone." In such cases, tests can be very expensive, and even if told it's a benign tumor, many still worry and wonder if it's safe to leave it alone. Taking those risks into consideration, I think it's really important to choose tests wisely. Now about organized cancer screening. As for screenings, I believe that everyone should get them. Since these screenings are officially recommended, I strongly suggest getting them at the recommended intervals once you reach the target age. As I said before, I suggest endoscopy for stomach cancer screening and X-ray exams for lung cancer, as done in Japan. However, if you are more concerned, I think it's a good idea to consult your primary doctor or a nearby hospital to see if you can get a low-dose computed tomography scan. How was that? This time, we've talked about the important truths regarding health checkups and cancer screenings that you should pay attention to. I have introduced some shocking facts and the correct way of thinking regarding health checkups and cancer screenings. If you take tests blindly and become anxious, it defeats the purpose. Knowing why you take tests and how to use the results to improve your health, those are the kinds of knowledge that truly become your weapons. And I believe that the regular company health checkups and specific health screenings are really a form of self-check for your health. It's not about finding diseases, but about comparing your current weight to last year, monitoring changes in cholesterol, and checking blood sugar and blood pressure. This is a good chance to reflect on your lifestyle habits. It's not about thinking, I've gone over the standard values, so it's all over and I need treatment. Not at all. I think it's really important to approach these checkups with the mindset that they're a way to maintain your body. Knowledge is powerful. I hope you'll keep learning with us at YouTube Medical University. Now let's review the video and cover key facts about health checkups. High-low density lipoprotein cholesterol and triglycerides, barium tests, chest x-rays, and prostate-specific antigen tests for prostate cancer. And I also talked about comprehensive medical checkups. Since this is a long video, I hope you'll listen to it multiple times and review it while taking notes. Feel free to share your thoughts on this video, advice from your doctor, lifestyle habits, opinions on tests, or any medication side effects you've experienced. Each of your experiences is valuable. If you don't mind, please share them with everyone so we can learn together. If you enjoyed this video, rate it with the like or dislike button. Your feedback helps us improve. See you next time.